Can status epilepticus lead to long-term brain damage? Have you ever wondered about the effects of status epilepticus on the brain? Status epilepticus, often abbreviated as Southeast, is a serious medical condition characterized by prolonged seizures lasting more than 5 minutes or repeated seizures without recovery in between. This condition can indeed lead to long-term brain damage. The continuous abnormal electrical activity during Southeast can injure brain cells, known as neurons, potentially resulting in lasting neurological deficits. When seizures last for an extended period, particularly around 30 minutes or longer, they can cause significant neuronal injury or even death. This damage can affect the brain's structure and function, leading to cognitive impairments and memory problems that may persist long after the seizures have stopped. Research shows that prolonged seizures can harm the hippocampus, a critical area of the brain for memory. Damage to this region can contribute to chronic epilepsy and cognitive decline. The risk of long-term brain damage from status epilepticus varies based on several factors. These include the duration of the seizure episode, the underlying cause of the seizures, the type of status epilepticus, the patient's age, and whether the seizures are difficult to control. For instance, older individuals, those with longer seizure durations, and certain types of Southeast are more likely to experience worse neurological outcomes. In children, prolonged seizures have been linked to reductions in cognitive and language abilities. Some of these impairments can become noticeable within a month after the event and may continue long-term. However, it is essential to recognize that some outcomes may also be influenced by the underlying neurological conditions that led to the seizures in the first place. Overall, status epilepticus is considered a medical emergency due to the risk of brain injury and long-term complications. Quick and effective treatment is crucial to minimize neuronal damage and improve the chances of better long-term outcomes. While some individuals may regain their functional abilities over time, others may face lasting neurological deficits or develop chronic epilepsy following Southeast. In conclusion, status epilepticus can indeed lead to long-term brain damage through seizure-induced neuronal injury, especially when seizures are prolonged and not promptly controlled. The severity of these long-term effects can vary based on individual circumstances and the underlying causes of the seizures. Early recognition and treatment are vital in reducing the risk of permanent brain damage. Always consult healthcare professionals for personalized medical advice and support.